Why worry about irreversible, focused ultrasound for Parkinson's? Imagine a treatment that uses sound waves to target and destroy small areas in the brain to help with Parkinson's symptoms. That's what focused ultrasound does. It's a newer, non-invasive option that can reduce tremors and other motor issues. But because it creates a permanent change in the brain, it's important to understand the potential risks involved. The main concern is that the lesion created by focused ultrasound is irreversible. Once the tissue is destroyed, it cannot be undone. Unlike treatments like deep brain stimulation, which can be adjusted or turned off, the damage from focused ultrasound stays. If side effects like numbness, weakness, speech problems, or balance issues happen, they might be permanent because the lesion cannot be reversed. While most patients tolerate focused ultrasound well and experience only mild, temporary side effects, some do have longer-lasting problems. Since the treatment involves permanent tissue destruction, any adverse effects are also permanent. This makes careful patient selection and precise targeting essential to minimize risks. Another important point is that long-term data on focused ultrasound for Parkinson's is still limited. The treatment has been approved relatively recently, and most studies show benefits lasting up to a year or more. But we don't yet know what might happen years down the line. Because the lesion is permanent, any late-emerging side effects or changes cannot be reversed or corrected. Most current focused ultrasound treatments target only one side of the brain to improve symptoms on the opposite side of the body. Treating both sides is more complicated and carries higher risks because of the cumulative effect of two lesions. This limits how much symptom relief can be achieved and requires careful decision-making about which symptoms to treat. It's also crucial to remember that focused ultrasound is a symptom management tool. It does not cure Parkinson's disease or slow its progression. Patients and caregivers should understand that it offers relief for certain motor symptoms but doesn't address the underlying disease process. Because of these factors, personalized medical advice is vital. Not everyone with Parkinson's is a good candidate for focused ultrasound. Healthcare professionals need to evaluate individual symptoms, disease stage, overall health, and personal preferences before recommending this treatment. In summary, the key reason to be cautious about irreversible focused ultrasound is that it creates a permanent brain lesion. If complications or side effects occur, they cannot be undone. While it offers a promising option for symptom relief, the potential risks and unknown long-term effects mean that careful consideration and consultation with medical experts are essential. Patients should weigh the benefits against the risks and discuss all available options with their healthcare team to make the best decision for their specific situation.